For this video, I will be demonstrating how to do the physical examination of the heart. First step is hand hygiene. After comprehensive hand hygiene, you are ready for the physical examination. In the examination room, introduce yourself to the patient, explain the procedure of the examination, and gain consent. Start the physical exam with a general inspection and a specific inspection of the hands. Check the patient's capillary refill time. Less than 2 seconds is normal. Also perform the Schamroth window test by asking the patient to bring his 2 fingernails together. This is used to identify or confirm finger clubbing. Next, measure the jugular venous pressure. The JVP reflects pressure in the right atrium. That is, the central venous pressure. It also provides valuable information about the patient's volume status and cardiac function. Make the patient comfortable in supine position with the head of the bed elevated to about 30 degrees. Assess jugular venous pressure by letting the patient turn his face to the left with 45 degrees. Measure the oscillation point of pulsation in the right jugular vein. With the use of a 3x5 card, point towards the highest point of the right internal jugular vein. Then put the ruler perpendicular to the sternal angle. Make sure the card is horizontal and right angle to the ruler. The vertical distance in centimeters above the sternal angle where the card crosses the ruler is the jugular venous pressure. Next, assess the carotid pulse. Your assessment will include both palpation to assess the amplitude and contour of the carotid upstroke and auscultation for the presence and absence of bruits from turbulent blood flow. Place your index and middle fingers on the right carotid artery in the lower third of the neck and palpate for pulsations. For the left carotid artery, use your right fingers. After palpating the carotid arteries, listen over both arteries with the diaphragm of your stethoscope. The carotid pulse provides valuable information about valvular heart disease and is especially useful in detecting aortic stenosis or aortic insufficiency. Now, we move on to the main part of this physical exam, the examination of the heart. Your examination of the heart consists of inspection, palpation, and auscultation. Let's begin with inspection and palpation. Stand at the patient's right side. Have the patient remain supine with the upper body raised to 30 degrees. First, inspect the interior chest and note for any heaves or lifts. Now proceed with palpating the chest wall. First, palpate for heaves using your finger pads. Hold them flat or obliquely on the body surface as you palpate in the right and left second interspaces, along the left sternal border and in the apical area. Then check for thrills by pressing the ball of your hand firmly on the chest in these same locations. Next, identify the apical impulse. If you experience difficulty in locating the apical impulse, ask the patient to partially roll onto his left lateral side. Palpate using the palmar surfaces of several fingers to confirm the characteristics of the apical impulse. After palpation is auscultation. You will listen for S1 and S2 in each of the 6 listening areas with a diaphragm. Start with the aortic area in the second right intercostal space close to the sternum. Pulmonary area in the second left intercostal space close to the sternum, Erb's point in the third left intercostal space, tricuspid area in the fourth or fifth left intercostal space, and finally, the mitral area in the apex. Now, switch to the bell of the stethoscope. Auscultate on these same locations. Next, roll the patient partly onto the left side and use the bell to detect diastolic sounds such as mitral stenosis or an S3. Then, with the patient seated and leaning forward, listen along the left sternal border and at the apex for the high-pitched, soft-blowing, decrescendo diastolic murmur of the aortic regurgitation. Ask the patient if he has any questions and brief him about the results of the physical exam. Don't forget to thank the patient for his time and cooperation. That's it for the physical examination of the heart. Thank you for watching!